Dr. Grove here again with your latest update. I'm very pleased to have Rabbi Dr. Aaron Glatt. Dr. Glatt is so busy that we're going to do a brief intro. He's the chairman of the Department of Medicine and the chief of infectious disease and the hospital epidemiologist at Mount Sinai South Nassau Hospital. He's also a rabbi and appears like somewhat of an overachiever too. He's become relatively, I guess, locally famous for his weekly COVID updates in the area. In the area you live in, the Five Towns. Is that correct? Okay.
Correct.
So since we have you, I figure we get an expert. I wanted to sort of deal with three quick things.
Sure.
Okay. So there are three main factors that people have to sort of address or evaluate when evaluating the risk of COVID, the way I see it. One is the risk of harm to themselves. Two is the risk of harm to others. And three is the risk of annoyance or loss of income for somebody who maybe has to go in quarantine or miss time from work. How do you advise people to balance these risks?
So I would add one more risk.
Okay.
Maybe it's even more important than all the others. And that's making a Kiddush Hashem, making a Chilul Hashem, and along with that, Ava, which is causing hatred amongst the non-Jewish world towards the Jewish people. We have an opportunity with all of this to lead. We have an opportunity to hold our heads up high and say, this is the way a religious Jew is taught to act from a both halachic point of view and from a medical point of view. And we follow what the Torah demands of us. The Torah demands of us, that we're supposed to follow what the medical experts tell us to do. And we do that with joy. It's a mitzvah. It's a good thing. And then we do all the three things that you just said. We protect ourselves, we protect others. And I think that goes along with protecting our jobs and protecting our sanity and protecting our psychosocial lives. I don't view them as being in conflict at all. I think the safer we are, the more open we will become, not closed. We're not shutting down like we did by Purim Pesach time. We're actually gradually opening up in the way that we can open everything up so people have their parnasa, so people have social lives that aren't causing them depression, is by following the basic rules. And if I can just reiterate them, because I want to make sure everybody understands what I'm talking about. We're dealing here with, obviously, masking appropriately. When I take a walk with my wife, I do not wear a mask. It's not necessary. It's cumbersome and annoying. But as soon as I get near anybody else, if I'm taking a walk, I always have a mask on me, and I'll put the mask on unless we're waving from across the street, hello. Then you don't need to wear a mask. When you're in any indoor space, and even in an outdoor space where you're near other people, you must wear a mask. You're wearing a mask to protect everyone else as well as yourself, but mostly to protect everyone else. And the social distancing is critically important indoors. It's also important outdoors. And I think the most important thing that people neglect is that don't go to any of these events if you or anyone in your family is not feeling well. The best way that we can prevent having all these myriad of questions that I get is, was I exposed? Was I not exposed? Is this considered a significant exposure or not? The CDC changed their definition. Aerosol, droplet, all the controversies. If you don't go out when you or someone in your family is sick, and you realize that from a halachic point of view, you're actually forbidden, the poskim, every posik I've spoken with says you're forbidden to go out when you're feeling sick in this situation. You could be causing somebody to Rahman al-Islam get a fatal illness. So even though we're doing better, you don't have the right to put somebody else's life at stake because you want to daven with a minion, because you want to go to yeshiva, because you want to go to the supermarket. So you don't have the right, halachically. We're supposed to be following what the halacha says. And you don't have the halachic right to go to a place, a public place, and put other people at risk. That's, to me, the key, how to accomplish all the wonderful things that you said we all want to do, which is to keep society open, keep people with jobs, keep businesses open, and certainly keep shuls and yeshivas open. We can do this by screening who goes out in public, self-screening, by masking, by distancing, and then also, washing your hands is appropriate. It's a simple formula. It isn't that difficult.
Right. I remember, I think I read in the Spanish flu in 1918, they were recommending masking, quarantine. Not much has changed in 100 years. With all that in mind, though, is it possible, us and our physicians, we get these questions all the time. Is it possible to have Shabbos guests? And if
So-
so, how can it be done safely indoors? As it gets colder, people are going to be wondering this. They want to have guests, and you can't go out in the patio when it's really cold outside.
So again, until that occurs in different parts of the country, just doesn't get that cold. And I would tell people outdoors is always safer. And I also tell people that you can go indoors if you follow the rules. You have to be masked and distanced as best as possible in a large room with a small number of people. You're not going to have 30 couples all together in someone's dining room like we may have had in the past, where everybody is crowding around the table and eating. That's not going to happen for a little bit of time. If you would all want to be safe, you're putting other people at risk. And yes, I do think you can have some social interactions indoors, but maybe they don't have to be around the food. Maybe that has to be something that we give up somewhat by not having couples over for lunch. So have them over for, the conversation part afterwards. Have a shorter conversation with them instead of a 3 hour sitting around the table, discussion about everything under the sun. Maybe now's not the time to do that because it is more dangerous. And again, depending on where you live, depending on whether outdoors is at all an option, I would always recommend that be outdoors rather than indoors. And if it's not possible outdoors, I'm not saying that everybody has to be a hermit, but limiting the number of people so that you can mask and socially distance 10, 15 feet apart. If a window can be left open, even though it's a little bit cooler, that's better. And certainly it has to be in a decent sized room. Putting people in a closet and having a conversation for 40 minutes is just a dangerous thing, even when both parties are masked.
Uh-huh. Now, and I'm guessing the same is going to be true. A lot of people are, maybe it's different. Like, for example, if people want to have play dates, like, so you have small children locked up, some of them are not been in school, some have been in school. How would you advise people if they say, can we do play dates with the kids?
So again, play dates with children depends on the age of the children. If it's a 50-year-old couple having a play date with the next door 50-year-old couple play date, so then I can think they can do it, as I said, all masked and all socially distanced, right, outdoors rather than indoors. That would be the ideal. But obviously with 3-year-old kids, they're going to play with each other. So then I don't think a mask is an option, and I don't even try to put on a mask in those 3-year-old kids. But the adults that are there should try to distance, unless they're their own kids. The adults should try to distance from the other children as best as possible. And the adults certainly should be wearing a mask. As the kids get to an age, and please don't ask me what exactly is that age, as the children get to an age where they can wear a mask, it's safer if they all wear a mask. When I'm around my grandchildren, we're not in the same bubble. We're not able to do the things that we'd all love to do, which is hug each other and slobber all over each other and do all the things that we love to do and look forward in Yirtzeh Hashem to being able to do pretty soon again. I will always wear a mask. And the younger kids, they won't come as close to me for any significant period of time. And the older ones who can wear a mask, then we get a little bit closer, but we still try to distance. Until now, we've been doing it outdoors. As the weather is getting colder here in New York, I'm allowing it to be done indoors, but we again try to distance. I've always been a very big advocate for finding the pshara, the middle ground. Pshara means lukewarm. It means you're not doing it perfectly, because I don't think we can do everything perfectly, but we're not giving up. And just because you may have taken a little bit of a leniency in this doesn't mean, okay, now I do everything lenient. And again, judgment. People have to decide what they're willing to take a risk for. To go to a kiddush every single Shabbos, as I know is going on in some communities, with hundreds, if not large amounts of people, all packed together in a small indoor room, is, in my opinion, just insanity. It's keneged halacha. It doesn't make any sense. There's not one, find me one infectious disease person in the entire country that agrees to that. You will not find one out of the 10,000 that exist. So that's not even a minority opinion. It's zero opinion. And Shulchan Aruch says, if I tell you to be Machal Shabbos because somebody's at risk, you have to listen to me. You don't have the right not to listen to me. This is just in that same category. And people, the one thing I think people have to give up is these large food-based, non-religious gatherings. You can gather together for a shiur. We have live shiurim. I don't get a lot of questions about that. Yes, we can gather together for a live shiur. I tell people, don't sip coffee at the shiur. This isn't the time to have drinks. Have your coffee before you come to the shiur so you can stay masked the entire time. There is a lot of controversy as to how long COVID can stay in the air, how far it travels. In poorly ventilated rooms for a longer period of time, it's more of a potential concern. I can't quantify it, but to gather around the shmog, to gather around a small kiddush table and have everybody grabbing and touching and obviously eating without a mask, that's lunacy. That's going to close yeshivas. That's going to close shuls. That's going to close businesses. Look what's happening in England right now. England is shutting down again. That's a terrible situation. In parts of the United States, 41 states are seeing an increase right now over where they were last week. We're seeing increased hospitalizations. We're seeing increased ICUs. And Nebuch, we're seeing increased deaths. Even though our overall mortality rates individually are going down month by month, we do have some treatments. We do have better understanding how to manage these patients. At the same time, it is crazy to potentially sacrifice your kids going to yeshiva, your next door neighbor's parnasa, because you got a fresset at Kiddush.
Yeah, I mean, listen, I'm in the ICU now. I just intubated somebody, and we had somebody die this morning, both from COVID. We have 5.
So. Hashem Yerachim. Hashem Yerachim. People
we're
don't.
In Baltimore, where the numbers are low, so it doesn't go away. Let me ask you this. This is something that comes up a lot. There have been a lot of people who have been recently infected and have recovered. How does that change the risk evaluation for having Shabbos guests? Like, can you have Shabbos guests if they, had COVID 3 weeks ago, they're all better, they're off their isolation? Does that change the equation?
So I don't like to make general blanket statements because each case needs to be looked at individually. What I tell people in general is that within the 90 days after somebody has had COVID, and that's proven COVID, not, I had a little runny nose, somebody truly had a proven COVID illness. So we do not think that they're going to be contagious for a 90-day period of time, assuming they remain without symptoms. Or if they had some symptoms, the symptoms are continuously resolving. They may have a cough, they may have some fatigue for some significant period of time. They may have, quote, long COVID, and they may have some residual, but it's not new symptoms. As long as there are no new symptoms and they're not having fevers, so we do not think it's likely that they'll transmit or get COVID again within the next 90 days. Are we certain of that? No. It's pretty likely, though, that will be the case. So I can't make a general statement that those people can walk around with immunity and do whatever they want. I insist that they come to our shuls that they still mask. They actually have residual virus that's able to be detected. We're not 100% sure. We think it's not contagious virus, but we don't know in which patients there may be some potential that could be contagious virus. And there are second episodes of COVID. Some have even been reported within that 3-month period of time. But Baruch Hashem, we don't think those people pose the greatest of risks. But when you're dealing with public health, you got to look at the global picture. And I don't like to tell, well, you can go, you can't go. I think it becomes very dangerous. And also, not everybody has proven COVID. And not everybody really had a diagnosis. And not everybody's within 3 months. Purim is 6 months away. It's a long time away. It's more than 6 months away. And we have no idea. And anybody who says that they know for certain that, I have some residual antibody, I'm not contagious, we have no idea if that's true. Given the choice of having no antibody or antibody, yeah, I'd like to have antibody. It obviously may have some benefit. Our hope is that it has a significant amount of benefit. But to make medical decisions of public health policy based upon, I think, is keneged halacha and certainly keneged medical principles.
For sure. Okay, well, that's about it. If there's any other message, final parting message you'd want to have for the community of Baltimore, or whoever outside of Baltimore gets to watch this, now's your opportunity.
Okay, so I think many people are going through a pandemic fatigue. So in last week's Haftorah in Parshas Lech Lecha, it talked about lo yi'af lo yiga ein cheker l'svuno so. Don't be fatigued. Hashem will be yachlifu koach. He will restore our energy, our strength. We're at the precipice of seeing the light at the end of the tunnel. There were 3 studies last week that showed very good results with synthetic antibody. They're very encouraging. There is a vaccine coming down the pike. B'Yezras Hashem, it will be a safe and proven vaccine, and it'll have a good efficacy. And only when that's known will I recommend its usage, but I'm very hopeful that will occur. So with having better treatments, with having a vaccine potentially that will prevent further spread in a significant percentage of people, we're going to get close to that holy grail of immunity, herd immunity. And then maybe it will take a while still, but we can start getting back to doing some of the things that we've been talking about that we're still restricting in terms of large food gatherings and social gatherings that we all miss and love and look forward to. But we got to keep on being strong. We can't be pandemic fatigue, because Rahman al-Islam, that can lead to a permanent fatigue.
Thank you so much, Rabbi Dr. Glatt, for this. I mean, very, very helpful, very informative. And for those of us who are listening, is there a way that people can access your weekly talks on Motzi Shabbos?
Sure. So there is actually an email that they can sign up to, which I don't remember exactly what it is, but if they either call the Young Israel of Woodmere or email the Young Israel of Woodmere, go online. It's like YIW COVID update or something like that. I don't remember the exact email address, but the phone number of the shul is 516-295-0950, or they can go online and contact the shul. I don't know if online there is a way to register for the COVID updates. I don't do them now every Motzi Shabbos. I only try to do them now when there's something I think significant to say. And I send out handouts sometimes when I feel there's something significant to contribute. And I hope that I can just give shiurim on Saturday night rather than to give COVID updates.
Yeah. Okay, good. Well, thank you so much for everything, and keep up the good work.
Thank you. What you guys are doing is phenomenal, and I appreciate very much having the opportunity to speak on your podcast.
Thanks.